Hello, friends and colleagues. I'm delighted to have the opportunity to speak with you at the DCVMN conference about the Immunization Agenda 2030, the future decade of immunizations. I wish I could be there with you in person, but I'm glad that we can do this through a recording. As we think about the decade ahead, we really need first to focus on where we've gotten to with the Global Vaccine Action Plan. It's coming to an end in 2020, and we need a new vision and strategy for vaccines and immunizations to set a direction for the next decade that really engages and aligns the stakeholders, all of us, immunization and beyond at all levels. The issues are addressing emerging concerns, harnessing new solutions for impact, and reiterating the importance of vaccines in contributing to the broader health and development agendas. What I think is important is to define what's new in this Immunization Agenda 2030 compared with GVAP. We've had great successes of GVAP, but we all know that the goals were largely not achieved. Many of them were aspirational. As we envision this next decade, there are 10 items and ways of working that we think are going to result in changes and result in greater improvements and greater opportunity to reach goals. The first is a bottom-up approach, assuring that countries are in the driver's seat, communities are in the driver's seat. The second is the country context, really tailoring the interventions, the shifts in approach to each specific country context and adapting through the decade. One of the issues with GVAP was that it was a strategy, a vision, a plan, but it didn't have a mechanism to adapt through the decade to issues that were unforeseen at the outset and became quite critical during the course of the decade. A fourth is targeting our efforts towards inequities. And here we know that although vaccines have reached the vast majority of children, they have not reached children equally in all settings. And so where the gaps really exist relate to inequities. The fifth is really pursuing the immunization agenda through a strong systems focus. Immunizations have, for 40 years, at least if we go back to the initiation of the EPI program, it was developed as a vertical program, but we can't get to where we need to be unless that program really is embedded within a system approach now and takes advantage of the links through that system. The fifth is to recognize that there are some diseases, like measles, that have a biology and an epidemiology that is so remarkable in terms of identifying and showing where the unimmunized children are, that when we get measles right, it means that we have to have gotten the routine immunization right. And so we've defined to some degree measles as the indicator of whether or not a strong routine immunization system has achieved what it needs to achieve, and defining in that way that measles is a pathfinder for this strategy. We also want to recognize the importance of the life course approach, that vaccines are not only for children and infants, but we have vaccines for adolescents, for pregnant women, and certainly for adults and the elderly. And this needs more emphasis in this decade moving forward, a life course approach delivering the power of vaccines across all ages for everyone. And we can't do this without strong partnerships. Not only partnerships within the immunization community and in the health community, but beyond that. We fully recognize through the Immunization Agenda 2030 that harnessing the power of vaccines is going to take those partnerships with broad civil society organizations, sectors outside of immunization, including nutrition, our climate change colleagues, and others, in order to achieve the promise of vaccines. And innovation is central to this. Innovation doesn't just mean research, but it certainly does include research, but innovation at all levels, innovation around management of programs, innovation around delivery strategies, innovation around how the program is delivered, and innovation around how we engage with communities and center all of the work in families and in those who are seeking vaccines. And finally, self-sustainability. The approach is built on the concept that a better use of existing resources is critical for achieving success. Full recognition that the breadth of resources may not grow over the next decade delivered to vaccines. And so we have to do more with what we have, be more efficient in what we're using and what we're delivering, and certainly design for self-sustainability of these programs. So these are the 10 areas that are newly emphasized and new concepts within the Immunization Agenda 2030. And when these are lived out, the belief that we will have more impact and more access. So this new vision and strategy will build on and live within an ecosystem of recent strategies responding to a changing context. There are strategies that exist on both disease-specific pathogens, on partnership models, and on broad health goals that you see here. These are not exhaustive, there are many others. And the intent of the Immunization Agenda 2030 as a vision, a strategy, goal setting, and eventually operationalization is to be the umbrella within which or under which each of these other strategies can sit, and as they get renewed and as new strategies are developed, are responsive to the principles and the strategic priorities that are outlined in the Immunization Agenda 2030. It's also important to recognize that immunizations are linked to at least 14 of the 17 strategic development goals. So there are a broad set of compelling arguments for the value of vaccines and for the innovation space in this coming decade. SDG 3 is the health goal, and immunizations are a foundation of that health goal. They are the program that has the broadest reach and the deepest impact of any health program that we have across both age groups and across all countries. And yet immunizations touch on 13 other SDGs, including strengthening of families, protection against poverty, gender equity, equality and equity goals within the SDGs. So we see the importance of vaccines and immunization through this next era of the SDGs. The development of the IA 2030 has brought very broad representation of organizations across many geographies. The first co-creation convening included over 50 organizations and people from 30 countries across all regions. The idea was to have the community of participants in the immunization space and beyond create the ideas that would be centered within IA 2030, and so it is owned by all organizations and owned by all people. Participants created ideas and provided direction for the key components, the vision, the strategic priorities, and the operationalization of IA 2030 through a very active co-creation process that was dynamic and designed to surface a broad range of ideas and experience from the past decade that could be brought forward as a lesson for how things might change and need to change in order to have success. This large consultative process included not only this co-creation forum in March, where over 750 people have been consulted in face-to-face events that include regional face-to-face events across all regions. It's also been developed through the comments that have been received on a series of drafts of this document. Over 4,500 comments have been offered to the draft documents and incorporated into developing the proposal that is now going forward to SAGE and to the World Health Assembly. Over 60 organizations have been involved, both within immunization space and outside the immunization space, creating this consultative process that has tried to surface as many of the ideas and experiences as possible. So the Immunization Agenda 2030 will include two fundamental components. The first is the vision and strategy document. And this document is what has been worked on over the course of many months now, and it lays out the vision and the strategy. It's grounded on the lessons that have been brought forward from GVAP, and it grounds itself in a set of principles and core priorities, which I'll talk about in just a minute. The second part of the Immunization 2030 is a living part of the agenda. It will be the monitoring and evaluation framework, it will be the operationalization of the strategy, and it includes regional plans, strategies and priorities for disease-specific entities, and a literature repository so that this becomes a living component of IA 2030 through the course of the decade. So it's intended to be a living strategy and not just a static document that will be agreed to at the beginning of the decade. The vision and the impact goals are summarized here. The vision is a world where everyone, everywhere, at every age, fully benefits from vaccines for good health and well-being. And each of the components of this vision statement relate to impact goals, to reduce morbidity and mortality from vaccine-preventable diseases for all across the life course, again emphasizing the life course, leaving no one behind by increasing equitable access and use of new and existing vaccines. And finally, the component of the vision strategy for good health and well-being is to ensure good health and well-being for everyone by strengthening immunization within primary health care and contributing to universal health coverage and sustainable development. So those are the high-level impact goals that relate to each component of the vision statement. If we look now at the strategic framework, it's articulated around 7 strategic priorities. The first priority, and the overarching one that you see in the diagram, is an immunization program for primary health care and universal health coverage. This is the primary principle of the strategy, that immunization is both a foundation for primary health care and is the source of benefit from a strong primary health care system. The second strategic priority is commitment and demand. And without both commitment from countries, from governments, and demand from communities and a strength of confidence in vaccines, we have neither the opportunity to deliver those programs nor the opportunity for those programs to actually accrue their benefit. The third strategic priority is coverage and equity. And this is a priority that is really emphasized around the equitable distribution of the value of vaccines, both for new vaccine introduction and for uptake and coverage of vaccines. The fourth is life course and integration. And I've spoken already about the life course approach, that vaccines are not only for children, but certainly include adolescents, women of childbearing age, people in the adult age, and of course the elderly. And integration is critical because it means that vaccine programs are not siloed. They're actually built within and integrating within other health resources and health needs that people have. Outbreaks and emergencies are another strategic priority, the fifth strategic priority. And in this most recent period, we've seen an incredible resurgence of outbreaks. We expect that outbreaks and emergencies are not going to diminish over this decade, but may in fact increase. And vaccines need to be well positioned to both be preventive of outbreaks and to be responsive of outbreaks in as best way that they can be. The sixth priority is on supply and sustainability. The strategy envisions healthy markets so that supply is available and affordable when and where it's needed, and sustainability of these programs so that they don't have supply shortages and have a durability and a resilience both to economic issues and other sustainability issues. And the final priority, which really grounds everything, is research and innovation. And every one of these priorities should be using innovative methods, should be always trying to use research and new ways of doing things that improve the opportunity for vaccines and going always from good to better. So those are the 7 strategic priorities that are laid out in the agenda. And as every program thinks about how it can do better, it is using these priorities to really contemplate and design the improvements that can be made. The 7 priorities are underpinned by 4 principles. These are adaptive ways and means to guide the implementation. And these cross over all 7 priorities. So a people-focused approach, ensuring a responsiveness and putting people at the center, a responsiveness to the population needs, and adapting, therefore, to different contexts. A country-centered and country-owned approach, driving progress from the bottom up. That this is not a top-down strategy. This is really about countries owning what they need to do and measuring their program, delivering innovation, delivering research to improve those programs, and tailoring to the country context. The third is a partnership-based approach, aligning efforts to maximize the efforts of all of the participants in this community and beyond the immunization community. We have to be more effective and more efficient and more leveraging of our partnerships so that all elements are coming together to actually drive for impact. That includes the technical side of partnerships, the funding side of partnerships, the community organization side of partnerships, the advocacy component, the legislative component. So all of the elements of partnership need to align to maximize the impact. And the final is a data-driven approach, promoting evidence-based decisions. When we identify what works based on evidence, that's what should be propagated through the program, and assuring that we have evidence, both from surveillance on vaccine-preventable diseases, burden of disease, the evidence around which vaccines work, what schedules work, how we can best optimize vaccines, and how we can actually use evidence to drive the optimization also of the program itself through the practices that are used for vaccine delivery. The objectives here on supply and sustainability, which I'll emphasize because of the nature of the DCVM conference, is that all countries should have a reliable supply of appropriate, innovative, and affordable vaccines of assured quality. The second objective is to have adequate and predictable financing available for immunization through a health financing system that ensures efficient use of resources and universal and equitable access. So there are a number of key areas of focus on this supply and sustainability strategic priority. These include innovation and affordability, vaccine supply that is tailored to country national needs, timely access to assured quality of vaccines so that we don't have supply shortages and result in inability to offer vaccines when and where they're needed. Supply for emergency situations. This is an issue that requires innovation so that we have the opportunity both to stockpile and to create inventories in appropriate ways so that vaccines are available when and where they're needed for emergencies. And sufficient and predictable resources, meaning countries need the ability to have the financing and the other resources, human resources, actual physical resources to deliver immunization programs. And aligning partners around all of these objectives so that we're working together to address these key focus areas and assuring that we have solution space within the supply and sustainability area so that partners are aligned and working in leveraging each other. And finally, sustainable transitions from donors to local funding. The Gavi Alliance has worked tirelessly on addressing how countries can move from a donor supported environment to a self-sustaining environment. So these goals are to build healthy markets across all antigens at the global level, to safeguard access to quality-assured vaccines in a timely fashion in all countries, to ensure sufficient financial support for immunization programs across all countries, to achieve universal health coverage, again, an incredibly important component of universal health coverage, and to increase immunization domestic resources for aid-dependent countries, and when transitioning away from that aid, to secure government domestic funding to sustain the coverage of all the vaccines after the transition, and to assure that as new vaccines come forward, they are also affordable for introduction. So the 4 core principles that will guide the implementation of this 6th strategic priorities. I just want to go through how we would interpret these 4 principles. From a people-focused perspective, this means a strong focus on developing local human capacity for governance and management of immunization financing, and building an understanding of people's choices to inform better forecasting of current and future vaccine markets. So that's the interpretation of the people-focused core principle in relation to this strategic priority on supply and sustainability. The country-owned principle, how is that interpreted for this strategic priority? Well, it's really about the country capacity to plan for and secure the necessary financing for programs that would reduce their reliance on external support. The vision would be that countries can plan, forecast, budget, and procure vaccines to ensure the quality of vaccines used by their communities and populations. The third principle interpreted through this strategic priority on supply and sustainability is around partnership. And this principle is interpreted as enhancing partnerships to plan for and ensure long-term sustainable financing with clear goals, responsibilities, and accountabilities of all partners. Enhancing collaboration among key stakeholders to support a healthy vaccine market. And that healthy vaccine market is critical for assuring that long-term sustainability for supply. And then the final core principle, as interpreted for the supply and sustainability priority, is around data systems that need to be expanded to better allocate resources within national immunization programs, to monitor the use of those resources, and to better forecast vaccine demand, supply, and pricing. So that's how we would take those 4 core principles and interpret them in relation to this particular strategic priority. So just to give you an idea of the timeline on IA 2030 and the core document timeline, we've come through this period of generating a lot of ideas around IA 2030 and now narrowing the ideas down to a document on a vision and strategy, as I've tried to outline for you. So this is where we are today. In October, a SAGE submission has been made, and the SAGE meeting in mid-October. Following that, there will be information for all of the countries through a member state consultation process, and then an evaluation of this vision and strategy through the process that WHO has for engaging all countries in decision-making. And that's through the World Health Assembly process. And so this is what we would envision through the remainder of 2020, with the hope that the member states, that all countries would endorse the Immunization Agenda 2030 plan. And I want to emphasize that this is a vision and a strategy that is for all members of the immunization community. This is not a WHO plan. This was a process that WHO has led so that all community members can have a voice, all constituencies can have a voice in developing this overarching plan, and using the process that WHO has to get the country endorsement and country deliberation on a vision and strategy. So we would love to hear more from industry. The documents commit to having stronger collaboration with the private sector. What does that look like for our collaborations in practice? The IA 2030 also asks for a strong focus on self-sustainability and going further with existing resources through integration. And what are the implications of those aspirations for industry? And thirdly, there's a strong focus on innovation and on tailoring implementation. And this is another area where industry can contribute, and we have to define how industry can best contribute to these specific areas. So I'll stop there and thank you for the opportunity to present the Immunization Agenda 2030 vision and strategy and the overarching plan for the decade with the development of a monitoring and evaluation framework, a governance structure, and an operationalization of the vision and strategy to come forward in the next year or two. We also envision, as I mentioned before, that this is a living strategy. It's not a static strategy. We will face challenges over the decade that we can't envision now. And so the approach allows for this to be a more dynamic strategy that can adapt through the decade to the challenges that we face. And we look forward to working with all partners, and especially including industry, on living out this vision and strategy for vaccines for everyone, everywhere they need it. Thank you so much.